Hi there, I'm Dr. Strube. I'm a chiropractic physician in Pinellas Park, Florida. Got my pink shirt on today because it's Friday. Don't know why I do that, but I do. I want to talk a little bit about scoliosis. Scoliosis is a condition where there is a curve in the spine. If you look at someone from the front, theoretically their spine should be straight up and down. If it has a curve, that's what a scoliosis is. Now, depending on the degree of the curve and the severity of the curve will oftentimes determine what the best thing to do about it is. Worst case scenario with a very severe scoliosis, it may require surgery because it can begin to compromise the function of your heart and your lungs. And those are things you want to be working pretty well. The surgery is a tough one. They will open up the back, they will put metal rods on your spine, straighten it out, put you back together. It takes a long time to recuperate from that. And because you now have metal rods in your spine, your flexibility is pretty limited. So that would only be done in the most severe cases. Now, other things that can be done, and the scoliosis, for whatever reason, is a little bit more common in women than men. They are still debating what the real cause of scoliosis is, but the current thinking is it's muscular imbalance. If things are tighter on one side than they are on the other side, things are going to get pulled to the side of the tight muscles. What determines resting muscle tone, in other words, how much a muscle is contracted, it's all done by the brain. So you never have to think about, whether or not the muscles in your back are the same tightness on one side as they are on the other. So if the brain is sending messages to those muscles that is just a little bit off and one side is tighter than the other, that can cause a scoliosis to occur. Based on that knowledge, doing things that stimulate the other side of the brain to try and balance the muscle tone can be very helpful. And there are a number of things that can be done. Even some adjusting can be done that will stimulate one side of the brain more than the other. So that is one form of treatment for scoliosis. There are also stretches that can be very helpful, and I can't really demonstrate the stretches because it depends on the individual, which way their curve is going, that sort of thing. But stretching can be helpful. As I mentioned, the adjusting can be helpful. Traction can be helpful, especially traction that allows you to bend the traction device in a way that will straighten out the person's curve and then do the stretch. Now you're doing the stretch on a spine that is much straighter than it would normally be. It's more effective that way. Even things like massage can be helpful for a lot of the symptoms that might be associated with a scoliosis. So scoliosis isn't the end of the world. There are things that can be helpful. Usually by the time someone reaches skeletal maturity, and that's usually 18 or 20 years old, any scoliosis that they may have had is probably going to stop progressing. It's not an absolute guarantee, but that's the way it works for most people. So if you have a scoliosis as a kid, by the time you're 20, you're probably going to have as much as you're going to have as time goes on. But scoliosis can be very uncomfortable because the spine is designed to be straight up and down. If it's got a curve in it, puts more stress on one side than the other. It sort of predisposes you to some problems that you might not have had otherwise. So if you have a scoliosis, you should get yourself evaluated, and there are things that can be done that should be helpful. So I want to thank you for your time, and I'd like you to have a good day.